For those of you who don't know me already, my name is Neville, and I'm not a doctor, first of all, I should say. I'm just a guy who makes stuff on the internet, which I've been doing since even I was a kid, way back in the 90s. And in 2012, I figured out what all of you already know, that if you make money online, you can live anywhere, you can travel the world. So I became a nomad, and that's exactly what I did. But so why am I here to talk about health? Well, as a nomad, I had quite a few adventures along the way. The first time I needed healthcare while traveling, I was skiing in Gulmarg in Kashmir, like the Himalayas in India. It was way above my level. I shouldn't have been there. It was like super deep powder off-piste. I had no idea what I was doing. I fell, I injured my knee. They took me down the mountain in like a little sled. It was embarrassing. And slid me into this doctor's office, but it was basically a hut with a light bulb hanging from a string. And the doctor came in and I said, "So what's the diagnosis? What do I do?" And he said, "No more skiing." I destroyed the other knee skateboarding. I've had 5 surgeries, a panic attack in Japan, working all night, sleeping all day, not seeing the sun, too much coffee, and lost a kidney along the way. But it hasn't been all negative, lots of positives while traveling as well. I got married a few years ago in Portugal. I have 2 beautiful daughters born in Spain, waiting for me to come back home. And a few years ago, I was introduced to a very smart German programmer who might be here in the audience, who said something interesting to me that really resonated. It was like, have you noticed that as a nomad, when you're traveling and living abroad, it can be harder to take care of your health? And thinking about my own history, I was like, now that you mention it. And Mark, what he also said to me, when you're traveling and you're living abroad, it's harder to take care of your fitness and nutrition, right? Like every time you move to a new country, your fitness routine changes, you don't know where to get healthy food from. But also, if you do need to go to the doctor, if you do end up in the hospital, you don't have your family doctor from home who knows your whole history, for example. You might not even speak the language. You're not sure which hospital to go to, who to trust, how the system works. And so based on all of that, we set out on a mission, first Mark, and then I joined him later, and the rest of the Genki team. And over these past few years, we've been on a mission to help you make it easier to take care of your health wherever you go in the world as a nomad. We want to be a health partner for nomads. And over these past few years, we've helped over 50,000 nomads from more than 195 different countries traveling all over the world to do just that. Now, when I was preparing for Bansko, planning to come here, recently I was talking to a friend, a young guy, I think he's about 24, 25, and he knew about Genki. He's familiar with the company and our history and what we do. And he became a nomad earlier this year. And he said something that really surprised me. He knew about the insurance, and he said, "Have you had any claims? Has anyone needed to use the insurance so far?" And I was like, "Brother, last year," and we've grown quite a bit since then, but last year, we had over 1,000 claims in a month. And if you do the math on that, that's more than 30 claims a day, which means more than once an hour, a Genki member somewhere in the world is going to the doctor, going to the hospital, and sending us the bill or contacting us for help. And so I realized that actually, most people don't have that perspective. You as a nomad, you travel, and maybe you have some medical situation, some emergency, hopefully not. Fortunately, most of us don't. But very few of us actually have any perspective on what happens if you need to go to the hospital abroad. What should you do? What's the situation? And so I sat down together with the Genki team, with our customer support, the ones who are on the front lines, and with the data nerds to put together basically some interesting things that we've learned over these past few years about the most common reasons nomads end up needing medical care, what they wish they knew ahead of time, and what you can do today now to prepare it. So I mentioned my friend, he's 24, 25 years old, and a lot of us, when we're young, we're healthy, we think we're not really at risk for the things that usually put people in the hospital, the serious stuff, heart attacks, cancer, they're quite uncommon when you're young. But among nomads, actually, what happened, the things that nomads end up going to the hospital for, the things that you need to watch out for. First of all, if you take nothing else from my talk today, if there's only one thing you remember, please let it be this. Scooter accidents, especially in places like Bali and Thailand, are by far the most dangerous, the risk that you need to be most aware of. I'm not saying don't get on the scooter, don't ride them. I understand it's like the mode of transportation in a lot of these places. Just be aware that it is probably the most dangerous thing you'll do as a nomad. To give you an idea, we've had, unfortunately, a few Genki members who've even died. And the most common cause of death among Genki members, scooter accidents. So at a minimum, like wear a helmet, obviously don't drive drunk, be careful, especially if you're riding on the back of someone else's scooter, make sure they're not drunk, try to be safe. I understand it's in some cases unavoidable, but just treat it with the level of respect given how dangerous it can be. As I mentioned, we're young, we're healthy, we like to be active. I told you some of my own stories. So sports injuries are also quite common among nomads traveling around the world. We like to surf, we like to ski, hike, climb, all of this kind of stuff. So we see many cases nomads end up in the hospital with more basic injuries, but nevertheless injuries from these activities. If you're traveling in more tropical locations, again, you have things like dengue fever you're probably aware of, right? Tropical diseases, food poisoning is common. That's the stuff that most people kind of expect that they need to watch out for. But one that surprises people that actually comes up pretty often are things like dog bites. So depending where you're from, this might not be an issue in your country, but when you travel, you often have like stray dogs. Sometimes they can be aggressive. Usually they're okay. Places like Bali, that's certainly an issue. And even we had a member recently who was in the UAE, who was stung by a jellyfish. Something simple, they were swimming, it happens, they got stung by a jellyfish. But for whatever reason, it became infected and they had to go to the hospital. And they ended up with a 12,000 euro hospital bill from whatever additional procedures were needed to be done because of the severity of what happened. So again, it's not something that most people think about when you're starting to travel. You just go for a swim. You have this idea that even you could get stung by a jellyfish. But when I mentioned the UAE, people are like, oh, okay, but sure, it's super expensive there, right? Like people are driving around in gold-plated Lamborghinis, so you kind of expect that maybe it's expensive. Last year, we had a Genki member who was young, in his 30s, who was bit by a stray dog in Bali. As I said, it's quite a common thing. The bite wasn't so bad, he was okay, but it broke the skin. There was some blood. And so he went to the doctor to get checked out. And there was a concern. They didn't know, they didn't have the dog, but there was a concern, for example, that the dog could be rabid and that he could get rabies as a result. And the problem with rabies is, by the time you show symptoms, it's 100% fatal. Right? Everyone who gets to that point, with I think one exception over the last 100 years, has died. So you don't wait for that, right? So immediately they said, okay, we're going to give you these antibiotics, and we give you these rabies shots and all this. And he calls us because we're the insurance, and we get a bill for 3,000 euros. Yeah, so even in a place like Bali, the thing to understand is that the cost of living might be much lower than back home. Your breakfast, your acai bowl, your bungalow on the beach, these things can be much cheaper. And healthcare, in some cases, in other countries, can be much cheaper as well, right? So if you just go to the dentist for a filling, if you go to the doctor for a routine checkup, a lot of times, especially as I say, I'm from the US, those things are always cheaper abroad than back home. But if you end up in the hospital, especially if you have an emergency, especially if you need trauma care, and for us as nomads, when we're traveling, typically we're not part of the public system in these countries. So we're going to private hospitals. We want to have the best doctors, right? If you have a serious medical issue, you always want the best hospital, the best doctor, ideally someone who speaks your language, or at least who has maybe English as a common language, a clean facility. They exist. There's great hospitals and doctors in these countries. But just like your Airbnbs have gotten more expensive, what's happened is nomads are now flocking, and tourists, to these hotspots, places like Bali and Thailand and Mexico and Colombia, and places that we all like to go to. And what happens is the demand has grown so much faster than the supply, right? It takes a long time to train a new doctor. It takes a lot of money and time to build a new hospital. So the private hospitals in places like Thailand, or now the medical inflation cost, the cost of healthcare is going up at such a rate that tell you, it's almost every month now that we see an extreme high cost case from places like Thailand. Thailand in particular, I would say, is the worst right now, but Mexico is climbing as well. We see bills that are routinely something like 70 or 100,000 euros for like complicated surgeries, which do happen. And it's gotten to a point now where in those countries, particularly in Thailand, medical costs for the same procedure there are now, in some cases, 2 and 3 times more expensive than you would pay here in Europe, right? So when we look at the cost of something in Germany in a good hospital versus in Thailand in a good private hospital, it can be 3 times more expensive in Thailand. And for most people I talk to, this is shocking. We expect that, it's a cheap country, it's going to be cheaper. Now, the next one, this is something for me personally. My attitude in life in general is, I figure it out. It's like, oh, if anything happens, I'll just figure it out. I think this is a great attitude to have as a traveler, as a nomad. I think you kind of have to think this way. Don't pack too much. They sell t-shirts everywhere. If you need to buy something, you can find it. Don't plan too much. Let's be spontaneous, maybe change plans, keep the trip open-ended, be open to adventure. This works really well as a nomad. As I said, I think you have to think this way. Probably most of us think this way. Unfortunately, that attitude doesn't work when it comes to your health. So what happens? If you end up in the hospital, if you have some kind of an emergency, in the US, in Europe, most of the countries where we come from as nomads, the most common nomad origin countries, Australia, the UK, if you go to the hospital and you have a medical emergency, it might be super expensive, right? Especially in the States, but they're required to treat you. If you walk into an emergency room and you have an emergency, they must treat you. They can send you a huge bill afterwards, but they have to treat you by law as part of like their license as a hospital. And one of the things I've learned since we started Genki is that that's not the case worldwide. So if you, especially as a foreigner, walk into a private hospital in another country, what often happens is they say to you, okay, yeah, we can help you, but please first pay. And you saw some of the bills that we've seen, right? 5,000 euros, 10,000 euros. It's extremely common. We get calls from people. We get people contacting us who are Genki members saying they're in the hospital and the hospital is demanding 5,000, 10,000 euros before they will treat them. Right? And so again, this is different depending on what country you're from. These laws vary depending on where you are in the world. In the most extreme cases, this was in the news last year or the year before in Thailand, there was a man who was taken to the hospital. He was having a medical emergency. He couldn't pay them up front. I think he was even not fully conscious. There was some confusion, so they didn't want to treat him because he couldn't pay, so they sent him to a different hospital, and he died on the way. And these things happen. So this is why I want to raise awareness to this, because most of us, we don't have that experience. It hasn't happened to us. Hopefully it never will. But just understand that you can't always just plan as you go, right? Even if you have the money, can you easily get 5,000, 10,000 euros in an emergency? It's 2 a.m, you go to the hospital and they're asking for money. How much can you actually pull from the ATM? Does your card work there? How long does it take if you need to make a transfer from overseas, for example? So what works well for travel doesn't always work well for health. Okay, the next common, I would say, myth or misconception, something that I find often as nomads, we think, well, I'm already covered by my bank, I have Revolut, or I have this credit card and it includes insurance or it includes travel insurance. Or sometimes when you book an Airbnb, there's a little checkbox, they upsell you to some kind of travel insurance, or when you book your flight or a hotel. Yeah? And this type of insurance, it's totally fine. I'm not saying don't buy this. You can buy this, but just understand what that insurance is made for. When you get traditional travel insurance, the stuff that costs, tens of euros typically, that kind of insurance is really made for your grandma going on a cruise, right? And she's worried that maybe for some reason the cruise will get canceled or she'll need to cancel, but she already paid them and she wants to get the money back. Or she's worried that the airline is going to lose her suitcase and she wants to get paid if this happens or the flight gets delayed. That's what that insurance is mainly for. Now, I know they often include some kind of emergency medical care, but what I stress is especially as a nomad, do not rely on that as your only health insurance. It is not designed to be your only health cover. And again, especially as nomads, if you dig into the fine print, unfortunately, there are many nomads who've thought they were covered, And then they end up in a hospital or even just going to a doctor and they think, oh yeah, I have this insurance. And then they go and call them or they submit a bill and the insurance says, sorry, like we only cover you for the first 30 days out of your home country, right? Oh, and you're still registered in your home country, right? I know there've been a lot of speakers here talking about like denationalize me, deregister, get out of the tax system in your home country, stop paying into that expensive social security, right? So they're based on the fact that, yeah, you have a registration in your home country and you're traveling for 30 days. I think if you have the highest Revolut plan, I think it covers you up to 90 days. You can check the details, but like they're covering you for a limited period of time based on the idea that you're traveling from your home country back to your home country. But we as nomads, like we want to travel long term. We like to be spontaneous. We extend our trips. We go to different countries that we weren't originally planning to. And so this kind of insurance, as I say, it can be great, but don't rely on it for your health. Also, if you dig into the details, you'll often see that things like scooter accidents and sports injuries are not covered at all. They totally exclude those. And in case they do cover you, what they typically cover you for is just like patching you up, putting you on a plane, and sending you back home. Right? And so again, some of us, we technically have a home country on our passport, but we don't live there anymore. Right? We don't have a house there. We don't have an apartment there. We might not have medical insurance there. We might not even have our family and friends there anymore. It's just like your passport country. So, as I say, that kind of insurance, it can be useful, but it's not designed to cover you fully for your health. Okay, so let's move on from doom and gloom and things to watch out for and into solutions and what you can do. So if you do get hurt or sick abroad, the first thing to know, and this is true in general, not just as a nomad, overall in life, but especially as a nomad, like you're in charge of your health. When you get sick, you're both the patient, but also like the project manager. Your job is to get all the information from the people to the other people and like connect all the systems together. Yeah, so what happens, like if you live in one country and you have your usual doctor, they know something about you. They can look you up in their computer. If you go to the doctor here in Bansko and you've never been to the doctor here in Bansko before, they know nothing about you. They don't know your history, they don't know your allergies, they don't know what medicines you're taking. It's up to you to give them all of that information. Yeah, so that's the first thing. Even if it's a simple doctor's appointment, like you have to give them the information or they don't know anything about you. Now, if you have like a more serious emergency, if you end up in the hospital somewhere, the first thing you should do, well, first of all, get medical care, right? Step one, get to a hospital if you're having an emergency. The next thing you should do as soon as you're able to, or if you're traveling with a partner, with a friend, boyfriend, girlfriend, whatever, or even the hospital, have them contact your insurance. So, and it's not just about the money. So we offer this at Genki, but I think most insurance companies have something similar. You can check if you have a different insurance, check with your insurance. Usually they have something like, ours is like we call it a 24/7 hospital assistance line. And so if you end up in the hospital, you contact them, or again, have the hospital or a friend contact them and tell them that you're in the hospital and what's going on. And they'll step in and do a few things that are super helpful. So first of all, they'll guarantee payment to the hospital. So this is important, right? So like you're no longer waiting for treatment because first you have to pay. The hospital has no idea who you are. They don't trust you. But when a big insurance company contacts them, and there's these networks of like assistance companies that we work with, and they all work with each other, and they're connected to literally every hospital in the world. So when they say, yeah, like 10,000 euros, no problem, here's a guarantee, they're good. Then they start treating you, right? Because they know they can get the money. That's the first thing. The second thing that they do is that, at least the way ours works, again, you can check with if you have different insurance, they monitor the quality of your care. So a lot of times you end up in the hospital in another country. Maybe you're, I don't know, scuba diving or surfing somewhere, like in a small island, and something happens and you get taken to the local doctor, like me in India, right? And the doctors are sometimes a little bit ambitious, and they say like, oh yeah, we can treat you for this, we'll take care of that. And you have no way of knowing, especially if you're not local in that country. And I'm not a doctor. I have no way of knowing, like, is this a good doctor? Can this hospital actually handle that? So when you contact these assistance services, what they can do is not only pay the hospital, but they can also evaluate, like, is this hospital really the place that can treat this thing that they're telling you that you have? Or should we get you kind of like patched up and then take you down the street to the better hospital that's actually equipped to handle that like surgery that they're recommending for you or something like that? So if you contact them, they can do that for you. The other thing that they can do is even say like, yeah, you're somewhere in Southeast Asia, and maybe they like bring you to Singapore or even bring you back home. If you say like, I need to have some serious surgery, they can again even get you patched up and then send you back home where you can recover, like where you have family and friends. I mean, hopefully you never need any of that, but just know that they can do that for you. And so you're not on your own in that situation, right? You have some help. Now, even if you have just like a really basic thing, like not an emergency, not the hospital, you just go to the doctor for something basic abroad. One more thing that you need to keep in mind, like we have members, as I say, from 195 different countries, and they're traveling in every country in the world practically. I had someone in Antarctica recently. So you multiply that out, like 195 countries, traveling in 200 countries around the world. That's like 40,000 combinations of like expectations and reality. And healthcare works a little bit differently wherever you go. And so what happens is like the doctor that you see doesn't necessarily know how your insurance works. And your insurance is not necessarily like set up and connected to that doctor. So again, you're the project manager or whoever is with you. And so before you leave the doctor's office, anytime you get any sort of medical help abroad, make sure you get like, just spend an extra 5 minutes and get like every possible piece of paper you can from them. Not just a bill, but like if the doctor prescribed any tests for you, if they did any treatments, anything that they did, get it in writing as much as you can. This is like one thing that, again, even for simple, non-emergency, not crazy stuff, people wish they knew in advance. Because like, let's say you're here in Bansko, you go to the doctor for something, and now you're, in Bali, Thailand, back home in the States, somewhere else. Like, good luck finding the doctor that you went to in Bansko, contacting them, telling them your name, asking them for this information later. It's so much easier if you just get it before leaving. So get the receipts, get anything that they did for you prescribed. And again, you might have to even be a little bit difficult with them because in their country, it might work a little bit. They might be more kind of like casual, just handwritten, simple scrap of paper, but just whatever you can get from them, like as a formal written prescription for anything that they did, is useful for the insurance, but it's also useful, as I mentioned, when you go to a doctor in future, if anything happens, if you have some recurring issue, or if they prescribed you something, being able to know what you got in the past, again, there's no like computer system where someone can just look this up. It's on you to get that information. So like get it all on paper, take a little picture on your phone, and have that ready. Okay, so the last thing I want to mention, something that you can do today, right? Even in just a few minutes, without any medical problem, like you're young, you're healthy, there's nothing going on, you're feeling good. Two things that can help you be prepared. So one, whenever you're traveling to a new place, just take 5 minutes. I mean, like literally 5 minutes. Like while you're waiting in line to board the plane, just do like some basic Google research or ChatGPT or whatever, just to understand like what are the risks in that place that you're going to. Like, can you drink the tap water? Is dengue fever a concern? Should you be watching out for mosquitoes? Just have some like basic understanding of what the health risks are. For example, like a few months ago, there was an earthquake in, I think, Myanmar, and it affected Thailand as well, right? So people were in Bangkok and different places in Thailand, and suddenly like condo buildings are shaking, and maybe you saw this on Instagram, like people are like hanging out in the pool and suddenly like everything is shaking and water's... Like they've never been in an earthquake before and had no idea there could be an earthquake in Thailand, and people, nomads, are like running around like headless chickens because they don't know, like, what do you do in an earthquake? So if you can, just take like 5 minutes, do some very basic research. And the other thing that you can do, and I strongly recommend this, if you have like one takeaway, you can do this today, again, just a few minutes, just create like a super basic personal health record. Yeah, just write down like any medical history that you have that's relevant. So like what medications are you taking? Yeah, if you've had any prior surgery or anything like that, if you have any allergies. This could be on your phone, but even better, like a single sheet of paper. Yeah, just jot this down now while you don't need it, while you're not stressed, there's no emergency, your internet is working. Because sometimes like the nature of an emergency is that you don't plan for it. Right? So it's like 2 a.m. and like your data's not working and you're in some other country. You don't want to have to be like searching for an email from 2 years ago that has your insurance company information. Yeah, so just take a few minutes, write down like if you have insurance, how do you get in touch with them? Is there some policy number or something that you need to know? Have that information handy if you ever need it. If you're traveling together with like a boyfriend, girlfriend, partner, friend, like make a copy of it and give it to each other so you have it for the other person as well. And that way, if either of you end up in going to the doctor or going to a hospital, you have that information at hand, save you a lot of time and stress in those moments. And lastly, I've mentioned insurance a bunch of times. I'm not here to sell you our insurance, just to say whatever insurance you have, if you already have it or if you're shopping for it, I suggest like just maybe even take a picture of this slide and just like run it through these questions, right? Make sure that it actually covers you in the way that you think it's covering you. That like it's covering you for the length of time you're traveling, for the sports and other activities that you do, for any countries that you're planning to travel to. Just make sure you're covered in the way that you think you are. Thank you very much.